Hi, I'm Dr. Casey Call, and I am an associate professor of professional practice at TCU in the Department of Psychology. I'm also the associate director of education at the Karyn Purvis Institute of Child Development. I've been at TCU since 2007. I started out in education. I taught elementary school. I was a middle school and high school counselor and really fell in love with helping kids who needed some additional help in the classroom. When I heard about the Hope Connection camp that was offered at TCU for families who had adopted, I immediately knew that's where I wanted to be. I went and observed one of the Hope Connection camps, and I saw Dr. Karyn Purvis working with kids, and I just sat in the back with tears streaming down my face thinking this is how kids should be treated. And I've been smitten ever since. There are 4 different styles of attachment. We have secure attachment, which means that you have a caregiver as an infant who is warm and responsive and meets your needs most of the time. The outcomes for that type of attachment are good social skills, persistent at task, lifelong, higher marital satisfaction, higher job satisfaction, all the good things that we want. There's also an attachment style called anxious avoidant. This type of attachment style, children with this type of attachment style have had a caregiver who was able to meet their instrumental needs, give them food and clothing and shelter, but had a harder time meeting their emotional needs, being really present for the times when they're sad or helping them when they're angry. There's also the 3rd type of attachment is anxious ambivalent attachment. This type of attachment style in children is seen when they've had caregivers who have given inconsistent care. So it's sometimes they're present, sometimes they're not present. The child kind of gets confused on, I don't know when I'm going to get my needs met and when I'm not. So I want to keep that caregiver in my presence and in my attention at all times. And then we have the last type of attachment style, which is disorganized attachment. And this happens when children don't have any clear strategies for getting their needs met. And this is the type of attachment style that has the most detrimental outcomes. These kids are at risk of higher psychopathology. They're at risk of more behavioral issues and substance abuse issues, health issues, physical health issues, mental health issues. So when you have an insecure or disorganized attachment, what typically happens in a secure attachment is that you feel distress, and then you have somebody meet your need, and then you feel comfort. And so what this does is it helps to regulate your nervous system. You've got your sympathetic nervous system that is activated when you're in distress, and then you have your parasympathetic nervous system that comes on when you feel comfort. And so over time, this builds up regulation within your nervous system. If you haven't had a caregiver who's met your needs consistently, what happens is you kind of stay with your sympathetic nervous system activated all the time. So you don't learn how to get distressed, how to calm, how to get distressed, how to calm. And so constantly staying kind of in that distress state with that activated state can look like being hypervigilant all the time. It can look like not paying attention, being hyperactive. To help children heal from unhealthy attachment relationships, we need to create predictable, safe environments and really help not only that we know a child is safe, but help them feel safe. We can do this by letting them know what's coming next. We can do this by making sure that we're meeting their nutrition needs, their hydration needs, their physical activity needs. And we also do this by really connecting and engaging with them, using eye contact and healthy touch, and really being present and listening to them.